Ladies and gentlemen, please welcome Dr. Zabina Bhasin, founder of InKids, Michael Nyenhuis, president and CEO at UNICEF USA, and Nancy Santiago of the Office of the Surgeon General, U.S. Department of Health and Human Services.
Welcome. Even before COVID-19, mental health challenges were a leading cause of disability and poor life outcomes, especially in our young people. Unfortunately, in the recent years, national surveys of youth have shown major increase in certain mental health symptoms, including depression and suicidal ideation. Today, I'd like to talk a little bit more about the mental health and what Michael and Nancy are doing with their advisory. For both of you, what parts of society would you like to see get more involved in tackling this crisis? And what can we do as everyday citizens to help our youth?
Thank you, Zabina. Good morning, everyone. I thank you for joining us today, and thank you to Michael for having this conversation with me. My name is Nancy Santiago. I work with the Office of the Surgeon General. And very recently, in December of 2021, the Surgeon General's Office released a report on youth mental health. For those of us that have been working on this issue, we're clear about the fact that mental health was a crisis in our communities long before the pandemic, but the pandemic has just exacerbated the situation. Right now, out of every 3 children reports feeling sense of loneliness and loss, depression, and those numbers are just escalating. It's a 40% increase over the last decade. So we know we have a problem, and we know we need to kind of bring this to the forefront for folks. The advisory, for those of you that don't know, when a Surgeon General puts out an advisory, it's the strongest tool we have to call attention to an issue. It is what raises a flag for the rest of us about what needs to be done. The advisory lays out not just the depth of the problem and the size and scale of it, which is getting bigger every day, but it also gives society different ways of getting engaged and different recommendations for what different sectors can do. In developing this advisory, we actually reached out to our friends at UNICEF USA who had done an extraordinary amount of work in this space. So you will notice if you go to the advisory, and you can find it online, it is referenced. But when we talk about what we can do about the problem, I think the most important thing that we can do is really think about how we destigmatize mental health in the United States. Most importantly for our young people, because we're looking at this as the next pandemic, but also even for us every day in our lives, talking about mental health as a more natural part of healthcare is incredibly important. We look to our partners in places like the media and the entertainment industry. How are they talking about mental health and showing it in the TVs and the streams that come into our homes every day? We talk to funders about what kind of investments they're making now that will help this situation. What's the early childhood prevention investments they're making? What are the investments in research that need to be made? We think about the financial sector, which is really important. We just this week did the beginning of a series of webinars, hopefully, between the Surgeon General and the Federal Reserve banks. And part of it is how do you get folks to understand the interconnectedness of healthcare and health inequities with economic inequities. Mm-hmm. When you look at a heat map where the worst impact was felt in terms of the pandemic, and then you also look, it's exactly the same map as where the largest inequities exist economically in our communities. So it's really important for us to think about the financial sector's role in this, investing in innovation, and investing in innovations driven by funders and founders of startup companies like yours that resemble those at highest risk. Mm-hmm. So how are we investing not just in the innovations that we need, but making sure that those innovations are being driven by the communities most impacted? I do ask that we pay special attention to the at-risk groups that we're looking at across the country. So when you ask what you can do or how the everyday citizen gets involved, I'd say look at everything that touches your everyday life. Media, what are you consuming? Where are you investing your money? How are you talking about mental health? And if you're someone who works in kind of the space, this ecosystem that we're in today, how are you promoting the investments that are going to lead us to the innovations that are going to solve many of the problems we're looking at. We have capacity issues in every place that touches children, in schools, in medical facilities, in daycare and pre-K services. We have gaps.
Yep.
How are you helping us fill those gaps to get the services to the children that need it most?
Absolutely. Early education is a priority. Michael, thank you.
Yeah, well, first of all, wonderful to be with you, and sorry I can't be with you in person today. And Nancy, always great to be on the same platform with you. We're so grateful that the Surgeon General referenced our guide for parents to help parents talk to their children about mental health in his report, and we're really grateful for that. And frankly, that's one of the constituencies we need to think about first as parents. We need to equip them with the tools to be able to talk to their children, to recognize the symptoms and the signs of depression and other mental health issues, so that they can be part of really the first response, as they should be as parents. But we're also interested in the youth themselves. That's a constituency we need to invest in as well. They know that this is a problem. UNICEF did a global survey of youth and a couple of issues of what they think UNICEF should be addressing, and a couple of issues rose to the top of that list for them, and mental health was one of them. So they know that this is an issue that needs to be addressed, and they want it addressed. We need their voices at the table. They need to be part of this conversation with us. And then I would say, third, we need to build capacity at with the service providers that are working directly with youth. We do that in a couple of ways. One is working with local community nonprofits that want to strengthen their mental health and psychosocial support work, and we've done that in a number of places. Additionally, we think there's a real important role for schools here. So we are championing a advocacy behind a bill in Washington that's moving its way through Congress that would increase grants to schools to provide more and better mental health services at the school level. So the closer we can get these services and get the capacity built to where kids are, they're in their homes, so that's parents, they're in their schools, so that's schools, they're served by local nonprofits and others, so all of those need our investment.
Thank you. I mean, we know that this is such an important issue, and we understand that, but let's get real. It takes our leaders a lot to pass. We don't even have family leave. So why do you think your call to actions are going to be successful and make a difference?
I think we're in a moment in time. We've never been here before, to be quite honest. We have a moment where we're finally talking about something as important as mental health as it relates to the pandemic. It's easy for us to make that connection now, but make no doubt about it, this moment will disappear. So I think if there's any time that we can fight to get to some of the pieces, the resources, the support, and the destigmatization we're trying to get to, it's right now. I would say that for the first time ever, I've had the Surgeon General speaking in front of Congress twice on mental health specifically. So I think it's critically important that we not just take advantage of this moment in time, but to Michael's point, engage our young people. The next generation is much more comfortable talking about mental health in a way than our parents ever were. And I think that youth voice is going to be critically important in asking those around us, holding us accountable for what we're doing in the here and now for them. But I do think we have a moment in time. I think it can pass because everyone's feeling the strain. But how many of us who are feeling the strain of the pandemic have actually asked for help? So again, destigmatizing it begins with us, but I think there's a moment in time that we have, and we have to act now before attention shifts somewhere else.
And attention is the most important, Michael. I would love to hear what's your mind guide could be successful along with the Surgeon General's initiatives.
Well, again, I think, I agree with Nancy that this is a moment. I think people have a new understanding of the impact of mental health coming through this pandemic. So, if we look for, I hate to call it a silver lining of the pandemic, it is that this is an issue people are willing to talk about more. And that's great. And again, I'll go back to the importance of parents having the tools to be able to do this. A lot of us parents, we come from a generation where mental health wasn't really talked about much. And Nancy's right. Youth want to talk about it. They've told that to us in surveys, both globally and here in the US. They want to talk about it. They know it's an issue. Our guide is for parents to help them know how to understand whatever age group their kids are in, that there's a way to talk about this with them. So we really need to give them the tools, whether it's parents, schools, direct service organizations, whoever it is, to really be able to do this and capture this moment.
Yeah, I agree with you on that, especially when we noticed that in our early estimation of the National Health Sciences in 2020, we saw almost over 6,000 deaths in the age groups of 10 to 24. So the urgency is now as well. And my last question to you is, we all know there's a sense of urgency. So fixing the problem is what? Like right now, what would be the initial act that we all can do to fix that problem?
I go to the seatbelt example. We talk about systemic change, and we want Congress to make change, but it starts with us. Seatbelts were not policy, right? It was not required in cars. Those of us that grew up in the 70s, and I'm dating myself, know that cars didn't necessarily all have seatbelts. That became public outcry for change. The term designated driver didn't exist until the media started to interject it. Right? It's now a term that we use regularly. Right. And it's something that we've built policies around in our country. So every time we look to Congress, and that is an important place to look, and we must hold them accountable, and government as well, those of us that represent government. But I do believe that the conversations around this start in this room, and shifting public opinion, and getting that public opinion to then put pressures on legislative bodies, on government agencies to make the change we know needs to be seen as critically important. So I say use your platforms to talk about it, use your investment dollars to change the systems and the resources and how we allocate them, and then let's use all of that pressure to change the structures that we need so that mental health becomes a focal part of what we do for young people in terms of the resources we provide to them and services we provide, but it also becomes part of the healthcare narrative without the negative stigma attached to it.
Michael, any suggestions of now?
Yeah, and I agree with all of that. And it's up to us, it's up to our communities to do that. There is a role for government, obviously. And so if there's one thing that you can do today, it's to urge the Senate to pass the bipartisan Mental Health Services for Students Act. It's been passed by the House, it needs to pass the Senate. It would give schools grants, additional grants to have mental health services in their schools, and we know that that's critically important. That's where students spend, or kids, adults, adolescents, and youth spend a majority of their time. So let's give the services there that they need. So call your senator, demand action on the Mental Health for Students Act.
That's the now, right now. Thank you so much, Nancy. Thank you
you
so much, Michael. If there's one thing you could end with of what we could do in this room today to help mental health in our youth, what would be the one thing that you could say right now to do?
Given the ecosystem and the folks that are in the room, how are you making investments that change this? How are you investing in innovation? How are you paying attention to the at-risk communities? How are you helping us build the ecosystem of support for young people? And quite honestly, how are we talking about it every day? So what's the language you're using? And walk the talk. Invest in the resources like early prevention, capacity building in schools, and research to help us get at this and make sure that we don't lose this moment.
Michael?
Just to echo something Nancy said, which is just talk about it, right? So the more we talk about it, the more that becomes part of the common language in our country, the more that youth hear us talk about it, the more they'll come forward. The more stigma goes away, the more services that will follow from that. So yeah, let's talk about it.
Thank you so much. Appreciate it. Thank you, Michael. Thank you for joining us today.
Thank you.